Hello everyone, I am Urologist Ömür Erdem Akkaya. The subject we will talk about today will be about which exercise and how long it can be good for erectile dysfunction, support to maintain erection and make the person healthier. Of course, as everyone knows, sports are very important for our general health. The nature of sexuality also requires effort capacity, exercising tolerance, and at the same time a sustainable erection. So which sport should we do? Scientific studies, meta-analysis results say that if you do conditioning exercises, aerobic exercises, about half an hour a day that will make you a little more breathless or a little sweaty, you will get better results about your sexual health. And there is no age for this. In fact, there are many studies that have shown that even in patients who have had a heart attack, who have undergone bypass and stent implantation after a heart attack, even progressive fast, that is, walking at a slightly faster pace than normal, has shown that complaints about erectile dysfunction at the end of 6 months are improved. Because some patients come to me and say, "Doctor, I have no erectile dysfunction, I can get erect, but when I have intercourse, I am out of breath after a while, I sweat and lose my erection." Some patients have low effort capacity. If the person does not exert any effort in his daily life, if he does not exercise, since he only needs to exert effort during sexual intercourse, his effort capacity is weak and it is not enough during intercourse. This, of course, can lead to erectile dysfunction during intercourse. So in the end, we need to protect our vascular health. On the other hand, there are Kegel exercises. I have already explained Kegel exercises in a detailed video. I can actually call Kegel exercises magic exercises. Kegel exercises are done by contracting the muscles surrounding the base of the buttocks, that is, the muscles we use while holding our urine. When we do Kegel exercises, we ensure that the blood supply to the base of the buttocks and the nerves in the penis are stimulated more. Thus, we see that it is good for complaints such as erectile dysfunction, premature ejaculation, and urinary incontinence. I will talk about a study. Kegel exercise publications usually have almost the same results. In patients who did Kegel exercises regularly and consciously for 3 months, 40% of the patients had complete improvement from erectile dysfunction, 35% had partial improvement and only 25% had no response after 3 months. There are publications comparing Viagra with Kegel exercise. There are publications comparing patients who took Viagra for 3 months. They showed that almost half of the patients' complaints improved. They have shown that the results are almost close to Viagra. I am talking about patients who get results. Kegel exercise is very important, as I said. It needs to be done 400 to 500 times a day. It is an exercise that can be done while sitting, lying or standing. While doing it, the person must see that the testicles are pulled up and the penis is pulled back. If the person does this consciously 400 to 500 times a day, he sees a serious benefit within 3 to 4 months. Exercises are actually a part of the treatment of erectile dysfunction. In other words, erectile dysfunction does not improve completely just by telling the patient to use Viagra or Cialis. Erectile dysfunction is actually a holistic disorder. So, in general, this is our video about erectile dysfunction and exercise. If you have any questions, if you want to consult, you can reach me via WhatsApp. Thank you for listening.